Hello and welcome to my channel. I'm Dr. Arshi, and today I want to discuss about the latest news regarding the COVID-19 drugs that made by Merck. These drugs called Molnupiravir. I already made a video regarding how does these drugs work, so if you want to watch that video, I will leave the link to that video in the description. But that has been said, if you want to know the latest news regarding these drugs, please follow me through this. So as I mentioned in my previous video, basically these drugs work by causing error within the replication of the virus genome. Basically these drugs cause mutation and errors within the replication of the virus genome material. Because as you all know, the virus will hijack the engine of the cell to produce its own genetic material, which is RNA, but these drugs cause these RNA to get mutated and cause the fatal error for the virus. So some sources basically explain that these drugs cause the virus to mutate itself to death. Although it's a very scary term to use, because then your mind will say, oh, what if it mutated to the point that it get more deadly? But it's not about that. The mutation happened in the sense that those final product of the RNA won't be able to be functional for the healthy virus. But there are so many things about these drugs that I basically don't like it. The first thing, while I understood that it worked with the RNA replication and it caused error within the RNA replication, it kind of reminded me of the Remdesivir. So Remdesivir was the drug that also supposed to block the RNA of the virus from replication. So basically it put the codon, it put the end to the genome of the virus inside the cell, which is caused to be stopped. That codon, that specific pulses basically tell the cell to stop producing more RNA. But that, as you all know, wasn't very effective. So some news has come up for the Molnupiravir that also not very heartwarming for me, especially in India. Some company tried to test the generic version of the Molnupiravir and apparently it didn't work. So the problem that right now I have with these drugs is, first, it worked for people with a very mild symptom to the medium symptom. So as we all know, these type of people mostly recover by themselves. So they tested these drugs for these type of people. So as you all know, within the 100 people who already got the coronavirus infection, roughly 90% will be recovered. So if you test the drugs within these 100 patients, and then it end up 90% of the people or 95% of these people won't go for hospitalization, won't get so bad, this is not a very good result in my opinion. Because our problem are with those people who face the problem and basically disease progress for the third phase, which cause their whole lung to be infected, and therefore later on they need hospitalization, the lack of oxygen inside their system, and so on. So basically, after I read about this trial in India, it kind of really stopped me from being too excited about these drugs. And all right, so that has been said, we are not very sure what's gonna happen next with these drugs. Still haven't approved, still haven't come to the market, and even before it comes to the market, there are so many negative news regarding its efficacy. Therefore, I cannot give you any hope regarding this anymore, unfortunately. So I will keep you updated once I get better sources. I really wanted to get all the information, then only put this video in YouTube. I hope this information was interesting for you. If it was, please don't forget to like and subscribe and share it with your friends. Until next time, I wish you all stay safe and well.